Thanks to James for joining us today. So James, let me just start off. First of all, let's do intros. I'm Jeff Richards. I'm one of the partners at GGV Capital. Hopefully for folks online here, we're a venture capital firm based around the world. We have about 85 folks across Asia and the United States. We manage about $6.5 billion and have several hundred portfolio companies. Given our global exposure, this topic around COVID-19 is very top of mind for us. We've sort of witnessed it moving around the world, and because of that, perhaps are more acutely aware of the impact, and felt like it was very important to get folks together to talk about it and to be able to ask questions of a trained medical professional, which of course I am not, and also have the expertise of our head of talent, Jen Holmstrom, who has ran a talent function at Facebook and now works with many of our portfolio companies talking about the talent function and people function. So we're going to cover two things. I'm going to introduce Jen and James, but one is just sort of medical topics around COVID-19. What is it? Why is it spreading? Why is it so important that we get a handle on it? And we'll ask James to share some of his thoughts around that. And secondly is around leadership, communication, corporate policy. What are some of the best practices that we're seeing our portfolio companies doing as well as other technology companies to deal with this issue? So let me start by handing it over to you, James, do an intro, and then maybe you can hand it over to Jen for the same.
Sure. Thanks, Jeff. So James Wantuck, I'm a physician by training. I'm a trained internist. I am the chief medical officer at Plushcare, which for those of you who don't know is a virtual primary care company. We do virtual visits with patients all over the country. We have 100 physicians on staff doing video and text-based interactions with patients. I'm also an instructor at Stanford Med School and generally interested in this. I'm not a epidemiologist, but hopefully can bring people up to speed from a medical perspective on what's going on here.
And James, can you just talk quickly about Plushcare?
Yeah, so Plushcare is a direct-to-consumer virtual medicine company. So patients can come to us, they choose a doctor, they choose a time, download the app, they can have a video visit with a doctor from their house. That doctor can write prescriptions, we can send lab tests. For COVID-19 specifically, we're gearing up to do an at-home test where we mail you a test, you mail it back, and we give you results as quickly as possible. That should launch in the next week or so. And so this is exactly what the CDC and the WHO is recommending, is that people are not going in and overwhelming the healthcare system. They're calling their doctor, they're doing telemedicine with a company like Plushcare.
Awesome. Jen, let me hand it over to you for an intro.
Sure. So as you mentioned, Jeff, I lead talent for GGV in the US. And what that means is working with startup companies of all stages with all things related to people. So that means hiring, developing, retaining, and as of late, working with remote teams, managing remote teams, and just thinking about best practices and ways to communicate with employees through this particular crisis.
I got to take it off mute. James, let me come back to you and just ask, let me start kind of high level. What is COVID-19? How did it start, and why has it sort of dramatically ramped up on everyone's radar in the last few weeks, in particular in the last, 72 hours?
Yeah. So over the past, 10 years, you're probably familiar with a number of emerging viral pathogens, whether it's the swine flu or avian flu or Ebola. These are all things that get on the radar and then to date haven't affected us, especially in the US, to a great degree. But this virus in particular emerged in China and rapidly spread. And not only is it rapidly spreading, but it seems to be causing severe illness and death in a higher proportion of people than we might otherwise expect. So the rapid spread, I think everyone has maybe seen in the news, the death rate seems to be maybe about 10 times as high as the flu. So for those people saying, maybe even just a few days ago, this is just a worst case of the flu, it seems to be much more severe than that. And so it's particularly affecting older people. And for all of us, we should be concerned not only about spreading it, but about having a severe illness from this. And then, sorry, to answer your question about sort of the ramp up in the past few days, I think people are kind of coming to the realization that the US is, one, the epidemic is not preventable at this point. It will infect some proportion of the US population. We will see thousands or maybe tens of thousands or more deaths from this in the US. And so do we want to become a country like China or South Korea or Singapore that rapidly responded and made changes to stop this from getting worse? Or is this going to go the way that Italy has gone, and the hospitals are overwhelmed, they can't care for all the patients, and the disease continues to spread? So I think that's the breaking point that's happened in the US in the past 2 days, and why it's risen to the top of everyone's radar.
And right now, we don't have a vaccine, we don't have a cure. So from what I understand, the only way health officials have come up with to slow the spread of this disease is to get people to avoid social situations and to sort of self-quarantine. Can you talk a little bit more about that and why that's so important and why it's so important to do it now?
Yeah, that's right. So some of you may have heard about the R naught of this disease, which is a marker of, for every person who gets the infection, how many people do they spread it to? This R naught is a measure of how infective it is. And the goal of keeping people apart, social isolation, washing your hands, covering your cough, is to reduce that number, reduce the effective number, so that the disease stops spreading as quickly, and so that hospitals can care for patients over a many-month period rather than trying to take care of everyone in a very short amount of time.
And what about, can you just talk about, I know one of the questions we got the other day was, if folks, for example, the San Jose airport announced that there were 3 TSA folks who've been, I guess, diagnosed with the virus. Yep. If folks are concerned, they were at San Jose airport or they were at a facility that has come out and said, hey, we've had somebody diagnosed with this, which we probably all will be. We all will have somewhere that we were in the last few weeks that will come out with this, just given how rapidly it's spreading. What should they do, and what questions should they be asking, and how should they be thinking about interacting with their family, et cetera?
Sure. So I think it's all about degree of risk. If you were definitely exposed to someone who you knew had this infection and you're not having any symptoms at all, you should be sort of self-quarantining, right? For probably 14 days. You should not be in contact with other people, family included. If you're in a community where it's spreading, like Santa Clara or certain parts of New York, Seattle, that means the disease is out there, but you weren't necessarily exposed. And so, if you're not having symptoms, you don't need to quarantine, but you should be isolating yourself to some degree and trying to avoid crowded spaces. And then if you are having symptoms, cough, fever, shortness of breath are the primary ones, those are reasons to seek medical attention, whether it's Plushcare or certainly you can call your doctor, you can call people to get advice. What we're encouraging people not to do is run to the ER, especially if you're feeling well. If you are so sick that you think you need to go to the ER, that would be the reason to do that.
But first line, make a phone call, try a telemedicine provider. I know Plushcare is an option. I know some companies have options like Teladoc or One Medical or others where there's a virtual option where you can literally book an appointment on your phone, do a video chat, and get answers to your questions. So that's what folks are recommending as a first line.
That's right. And at this time, it's still more likely that you have something else, the flu, a cold, bronchitis, a number of things. And those outlets will treat you for that. At Plushcare, we'll give you flu medicine or antibiotics if you need it, or help you figure out what's wrong if it's likely not to be COVID-19.
Awesome. So let me switch gears, Jen, hand it over to you, and maybe you can talk a little bit about what we have seen companies do over the last week, what some have done in the last few days, and sort of how we're thinking about this from a company perspective, from a policy perspective. And then secondly, from maybe you can talk a little about leadership and communication and what you're seeing in terms of best practices.
So I would say most of the companies, certainly in the GGV portfolio and in the extended tech community, have moved to a work from home. Many are, there's some debate right now about whether to mandate it or make it optional, but most are wherever they are along that spectrum. We've really moved as an industry, I think, to mostly working remotely. And as a result of that, companies are taking great measures in terms of communication. Communication is one of the most important things that I think companies can do right now, and that we're seeing across tech, and doing so effectively to really help to calm people and to get messages consistently distributed amongst employees, amongst customers. So figuring out a communication plan and strategy has been pretty important. And some of the just general high level things that I think leaders and managers can do to get arms around this is to, one, communicate quickly and regularly, either by virtue, a lot of people are using Slack or email or small video vignettes or whatever the forum is and channel. Pretty important to do that on a regular basis. Two, don't assume, more information leads to more informed people. So just being distilled in terms of, and direct in terms of the type of communication that you're sharing. And then also being really clear about what leaders are expecting of their teams, of the employee base broadly. So I think regular, effective communication is a really, really important part of the strategy. Some companies and humans are creative, so people, just to inject a slight bit of levity into a very serious situation. Companies are doing things like having costume parties on Zoom, and some people showing up in robes, hat parties. People are doing pet happy hours. I mean, all kinds of things to kind of keep teams connected. So lots of creative things going on. But just so everybody here today knows, we do have a list of policies and recommended, from legal resources down to just ideas from a cultural standpoint, and managing remote workforces. We have all of that posted on the GGV website.
So if you go to ggvc.com, ggvc.com, and scroll to the bottom, there's a link with an entire page. Jen and Bailey and the team have posted policies and information and articles and tweet storms and everything. Anything that we are finding that we think is helpful and relevant, we're posting.
Right, and we'll continue to add to that on a daily basis.
And Jen, what I guess what's the I'm now in day 4 of the work from home strategy, and I'm not loving it, to be honest. But what are some things that people are doing? You mentioned the costume parties. I know one company said they were going to order lunch for everybody once a week. I know Daydream Workboard said she's doing all hands every week now instead of once a month. Are there other kind of things that might sound quirky that are helping kind of jazz it up a little bit? Because I'll be very honest, it's you go from this very vibrant, active environment, particularly a lot of our companies that have really great cultures, where it's a lot of fun to be in the office and talk to other folks and engage, and all of a sudden you're sitting at home and you've got your cat.
Right.
And a candle.
Yeah.
Any other pro tips?
I think I would just recommend that to that point, humans are social beings. So increasing the frequency of communication, like going from a weekly meeting to a daily meeting, is not crazy. Doing daily stand-ups just so everybody can actually see each other. In terms of Zoom, or any kind of video conference, using the video, using the in-person so you can see each other feature is become pretty important. This is an interesting social experiment of sorts. to see, different personalities are going to gravitate one way or the other. But the more increasing communication to a much more frequent cadence, and using all channels. So setting up particular Slack channels just related to this particular point in time, or getting creative about how you keep, employee communities together is really, really important.
I would also add one of the things that Deidre posted in her tweet storm. By the way, if you guys haven't seen it, Deidre Paknad is the CEO of Workboard, and she posted a great set of tweets earlier this week that had some real good tips. But one of the things that she said is, I'm making it clear to the team that we not only care about the work and the business, but we also care about them personally and about their health. This whole work from home thing is a strategy to help our teams and our companies take care of themselves and be healthy. We don't want people coming to the office and getting others sick, which is a really important message right now as people are nervous, they're scared, they're trying to learn more about this virus. And there's not a lot of, we're catching up, but there hasn't been a lot of great information out there. And so I think also letting people know that you care about them on a personal level and you care about their health is also an important message.
I think that's a really good point. And just to also highlight Ryan Dennehy, who's the CEO and founder of Electric, has a great, Electric is an IT company for small and medium-sized businesses. And he has a whole host of resources on his Twitter feed. Mitchell Hashimoto, the founder of HashiCorp, also has a great set of resources. All of these we've tried to synthesize in our document on the website, but and we will continuously add, but there's some great stuff out there. And I did just want to mention that the CEO of Slack, Stuart Butterfield, posted yesterday, Slack has a whole support infrastructure that they've set up to help with the important communication tools that are going to help us get through this.
Yeah. So let's open it up to questions. Bailey, maybe you can chime in and give folks instructions on how to post questions, but want to open it up to questions for James and Jen.
Yeah, hey everyone, you can go ahead and include your question in the chat function that you should see at the bottom of your screen. And you can just type that in and we'll have the presenters read it out loud.
So click on which button, Bailey? Chat?
Chat, exactly.
Okay. So if folks have questions, click on the chat button, type it in, we'll read out the question, and James and Jen can answer it. I'm trying to think, Bailey or Jen or James, you guys remember the questions? We had a couple of questions the other day. I know one of them was about recommendations on, oh, here we go. So the question is, are there any benefits to calling it COVID-19 versus coronavirus?
Yeah, COVID-19 is what they're calling the disease that this is causing. So the constellation of signs and symptoms, so cough and fever and sort of the condition, versus coronavirus is the name for the virus itself. Sort of like the HIV/AIDS dilemma. People weren't sure what to call it back 20 years ago. So COVID-19 is the condition. Coronavirus is kind of a casual term for the family of viruses that are causing this disease.
Do we have a recommendation on one versus the other? I know we've been using COVID-19 just because it seems a little more of a, I don't know, coronavirus sort of.
Yeah, coronavirus is a little broad, and
yeah.
I think it's COVID-19. You know exactly what the person is referring to. So that would be my recommendation. That's what we've been using.
Is COVID-19?
Yeah.
Okay. Second question. Margie says, hi, thanks for doing this. Are any of your portfolio companies giving end dates for work from home? How are they deciding what will need to happen to come back to work? This is a great question that we have gotten as well.
That's a great question, Margie, and something that I would say most of the companies are grappling with. We've seen companies take two approaches in terms of term for work from home. Some companies are taking it in 2-week increments. So making a decision, making the decision that, for the next 2 weeks, and then making a decision at that point about ongoing practices. And in terms of deciding the parameters around the workforce returning to being in person, haven't seen a lot out there right now. I think this is more of a real-time thing that people are figuring out in time increments versus particular parameters. I have seen some companies actually come up with kind of a tiered response. So with X number of infected cases reported versus, tier 1, tier 2, tier 3, kind of an escalation. So that's one way of structuring thought and approach, but no particular parameters so far. As we get them, though, we'll certainly publish them. So we will hopefully respond to that as information comes in over time. Oh, sorry. Second approach is just people are out they're picking a really long end date. So April 30th, one company just reported versus kind of 2-week increments. It's a bit of a mix of both.
Yeah, and I would say this is also a broader question. I was talking to my 78-year-old dad last night, trying to give him a sense of how we're thinking about this. And he said, okay, so I stay in my house for 2 weeks, then what? And I said, we don't know. It's going to depend a lot on how quickly we can, as James mentioned earlier, bend the curve on the spreading of this virus. James, do you have any thoughts on timing?
Yeah, I think that's right. What we've seen, best data we have is from China, South Korea, where it seems like the curve peaked and troughed in about 2 months, but it's going to be dependent on how the public responds and how we're able to bend that curve.
Next question: how are policies evolving by region? While the Bay Area is moving to work from home, we aren't sure how to respond in other offices, Denver, Austin, etc., where we don't have as much insight into how local startups are responding. Do you have a thought on that, James or Jen?
Yeah, I think what we're seeing from around the country is that there's highly variable access to testing. And so depending on what state or city you're in, the cases may not be reported. California is reporting a lot of cases. Their testing capacity is high. Other states, not so much. So I think my advice would be, if there are non-essential people that don't need to be in the office, we should start thinking about working from almost, no matter where you are.
Yeah, I guess, and I've been reading a lot about this as well, James. So your point being, there are probably regions of the country that aren't, in the Bay Area, we're in Bay Area, New York in particular, where there are cases, in Seattle as well, we're particularly heightened awareness right now. And I've noticed this, that in some other regions of the country, they don't have that yet. That may not be because there aren't any cases. It may just be because they haven't actually tested enough folks to figure out where those cases are.
That's correct. Yep.
Yeah. Jen, do you have a point of view?
Yeah, I would just say from company policy standpoint, seeing more companies go to a blanket policy around the country or the world, frankly, just making kind of a call from HQ and making it universal.
Yeah, and I would also, just given our firm's global presence, we saw China go through this in January and February. And although there was one particular region which had the biggest outbreak, one of the reasons why they were able to slow the outbreak more generally across the country was they basically shut down the rest of the country. So it wasn't just focused on Wuhan province, which is a big province, but there are another 1.3 billion people in the country, and essentially stopped the movement of all those folks, and that's how they've slowed the curve. So my advice is, on a personal level, per James's point, would be treat all regions just like you're treating the Bay Area or New York or Seattle, because we probably just don't know about those cases yet. Next question. How risky is business travel at this point in time? Avoid at all costs, or is it okay if necessary? James, let's start with you.
Yeah, I think I traveled this past weekend, but it was for a personal funeral, actually. I don't think I would be traveling for business in the foreseeable future unless it was really fundamental to my business. I would try to hold meetings virtually, try to do everything you can virtually. I would certainly try to avoid it.
Jen, any thoughts on that? You're on mute. There you go.
Yep, I just would echo that. I think unless it's absolutely necessary, I would, at least for again, potentially in increments of 2 weeks, but just given how rapidly the spread is occurring here, I would limit travel unless completely necessary.
Okay, another
Team,
question.
we have a question on the Q&A function, which I'm not sure if you can see, but the question is, with many schools closing and parents who are working from home, how are businesses thinking about supporting parents who are required to work and also care for their children?
This is going to be a very, very, very topic, in my opinion, over the next week. It's going to hit our country like a ton of bricks. Jen, do you want to start there?
Sure. So I think potential differences here between hourly and full-time workers, that there are different types of workforces out there. A lot of the tech world has decided to go ahead and compensate and keep paying hourly workers, which hopefully is enabling some of them to both keep getting a paycheck and provide childcare or look after their children as they're not in school. But again, evolving situation. And as we get more around best practices here, we'll post them and broadcast them to this community, because it's kind of real time right now.
Yeah, I think this, I personally think this is one of the biggest issues we're going to face as a country over the next week. I retweeted Mark Cuban when they suspended the NBA season yesterday. They were interviewing him, and the first thing he said is, look, we've got to figure out how to take care of the people that run concessions, that sell tickets, that work the doors. Like, we can't just focus on the players. This is, and this is going to happen around the country. I was talking to my sister today who works with Google in Seattle, and she said they're already seeing restaurants in Seattle close. Well, there's a whole body of workers at each of those restaurants who are, going to be very concerned about pay and health insurance and other things. Not to mention, they're then going to have to turn around and figure out how to take care of their kids who aren't in school. So, hopefully for companies that can afford it, we take the best possible approach we can and try and care for everybody who's involved with the company. I know Twitter has announced that, Google has announced that. Aaron Levy from Box this morning just announced that they would continue to pay contract workers. It's going to be a tough, if we're lucky, and James, maybe you can add your thoughts here. If we're lucky, this is going to be a really severe situation for the next few weeks or a month or two, and then we'll start to come out of it. I don't really want to think about the alternative to that, but hopefully, if we look at what happened in China and South Korea and Singapore, it's going to be a really challenging few weeks. And to me, hopefully, a scenario where we as Americans, business owners, business leaders, et cetera, try to do as much as we can for everybody involved.
Yeah, I think that's right, Jeff. I would echo your concerns around that impact that school closings are going to have on everyone's lives. I do think, assuming we take the right action, and I think the country will, it seems like we're motivating. It's hard to get 300 million people to agree on anything, but I think this will be a short-term shock, an 8-week, and early May. Hard to know the precise date, but I think that's our best guess at this point.
If all goes well.
If all goes well.
Yeah. And I just wanted to mention, thank you, Emily. It looks like Handshake, GGV portfolio company, is putting together a whole list of resources for parents. So thank you for that. And once we have that, we will certainly publish it and make it available to the broader community. But thank you, Emily.
Yeah, I'm just going to post a link to the resource page on our website as well right now on the Q&A area. There, I just posted it. So Emily just said Handshake is hoping to put together a list of resources to share with parents about this, a list of things to keep kids entertained, ways to support parents, stipends for care, et cetera, among other things. It's a work in progress, but we'll be sure to share with the GGV portfolio when it's ready. So thank you for that. Margie also asked a question that said, how would you guys suggest communicating the economic impact of this? Jen or James, if you want to talk to that, I'm happy to answer it as well, because we've been having a lot of these conversations over the course of this week. Maybe I'll start. The short answer is we don't know. What we've been encouraging each of our portfolio companies to do at the top level is to rethink their budgets for the year and understand that there is likely to be some negative economic impact. I can tell you that in China, what we saw was 80% of our companies saw severe negative near-term economic impact. The good news is, surveying them in the last week, 80% of them are also feeling like there will not be long-term negative economic impact. So that was a very positive signal to us that this, at least it doesn't look like it's going to be a 2-year recession type event in China. We don't know how it'll play out here, but we've certainly encouraged our CEOs to take a hard look at their plan for the year, be very smart about managing their financial models, and just understanding that, you know, across the board, there's probably likely to be some hit to top line revenue. If you're selling top-down software, for example, all of a sudden you've got a buyer universe that's not in the office, they're not traveling, it's a little bit harder for them to get things done if they haven't been working this way traditionally. If you're selling to small business, you know, they've suddenly got a whole host of issues that they weren't anticipating. If your end customers are restaurants, they're going to be dealing with a whole set of issues around people not wanting to come in and dine. So just be aware of that, take that into consideration. Then I think for your teams, you know, a similar level of communication, just to say, hey, look, we're on top of this. We're aware of the issue. We're discussing it with our investors and with our board. We have a game plan. We're evaluating a couple of different options. Most of our portfolio companies throughout the course of this week and last week and or early next week have set up board calls to review their financial models. And so we're trying to get ahead of this and make sure that folks are very well prepared with a number of different scenarios so they can handle it appropriately. Jen, any other thoughts on that?
No, I think just coming up with this is obviously kind of task forces are forming amongst the leadership teams within the portfolio. And I think just regular cadence and clear and open communication around it with a bit of a long-term view, as Jeff just alluded to, and then also kind of short-term implications. So strategy there to help with the blocking and tackling in the everyday will be really useful to employees.
I will say, you know, I just did a podcast yesterday and they asked me, you know, same question. And I said, look, we think there's going to be a lot of near-term financial impact. It's a little bit hard to estimate, but having been through several market cycles, I was here in the dot-com bubble, I was here in 08, 09, there's usually a more severe impact than you anticipate. And it's hard to see it at the outset, but there's a little bit of a domino effect. Having said that, we're very positive on the 6, 12, 18, you know, 2-year outlook for tech companies in particular. You know, we just announced a new investment this week. We signed off on 2 new investments on Monday. We signed off on several follow-on investments. So we're continuing to see folks in the venture capital community put money to work. We believe that the companies we backed are great companies and strong companies and have hugely bright futures. One thing I would offer is if any of you would like to have an investor or a board member do a Zoom call with your employees or your management teams, I'm certainly happy to do that. And I'm sure your other investors and board members would be happy to do that as well. Obviously, the idea being to give some sort of a balanced perspective, but also to reinforce the long-term belief in the company and the opportunity ahead, because that's important, right? Folks get nervous and they see a near-term impact and they can't really think what that might look like 6 or 9 months down the road. But, you know, a lot of these companies, all companies are in good sectors, good categories that are going to have long-term opportunities. And for those of us who've been through cycles, you know, you look at the 08, 09 cycle, which is a really, really, really severe financial crisis that lasted for quite some time. Some of the best companies in the universe, you know, came out of that cycle. Stripe, Square, you know, Facebook powered through that cycle. Twitter powered through that cycle. So a lot of our best companies today were built in that era, and we think the same thing will happen here. We just have to manage through the next 30, 60, 90 days. Hopefully it's not longer than that. But you know, really take a positive approach and a strong level of communication in the near term. Any other questions? I don't see anything else popping up right now, and I want to be conscious of folks' time. If you do have a question, type it in. If not, James or Jen, anything else we didn't cover that we should have?
I don't think so.
I think that that wraps it. Yeah. Wash your hands.
Yeah.
By the way, one question I got, James. A lot of folks talking about hand sanitizer. Do you have a view on hand sanitizer versus washing your hands?
Washing your hands is most effective, but hand sanitizer works tremendously well. So I would say both. I use both all the time.
Okay, awesome. Thank you. Thanks everybody for joining.
Thanks everybody.
Take care and good luck.
Everyone.
Take care.